Hello, everybody. Good afternoon. It is so great to see you today on this very snowy day, so we hope you're staying safe and warm. But my name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute, and I would like to welcome you to our very first session of the 2025 Bring It Learning Series, Unpacking Insurance Coverage in Kansas. So, Bring It is a learning series offered by KHI where we can all come together for sessions about health policy topics related to issues that may be considered during this year's legislative session in Kansas. We call these sessions Bring Its because it's an opportunity to come together over the lunch hour and where you can bring your questions and perspectives. And so, before we get started, I'm just going to share a few pieces of information with you. So, a little bit about who we are. KHI, or the Kansas Health Institute, is a nonprofit, nonpartisan educational organization, and we're based in Topeka. We were established in 1995 with a multi-year grant from the Kansas Health Foundation, and this year we're very excited to be celebrating our 30th anniversary. And you can see in the photo there, that's our building, and it's right across the street from the Capitol. And so here at KHI, we work towards the vision of a healthier Kansas through effective policy. And we do this by providing nonpartisan research, education, and engagement opportunities. Here at KHI, we are committed to convening meaningful conversations around tough topics related to health, just like we're doing today. And so our approach is pretty comprehensive. If you've been on our website or in our building, you'll see that our work involves research, evaluation, technical assistance, and policy analysis, as well as podcasts, blogs, and gatherings like today's event. We are offering a total of 5 Bring It sessions, and the next one is this Thursday, and it will be focusing on Medicaid and what to expect in 2025. So if you still need to register or you would like to share the event information with a colleague or someone in your network, you'll find that link in the chat. Or if you visit our website, you can also find it on the events page. Okay, now we'd like to take a moment to acknowledge the wonderful authors of all the annual insurance update products that you see coming out of KHI. This team of experts brings together really important insurance coverage data in a variety of informative and engaging products. And so you'll hear from them today, and you'll also hear about a lot of those products today. And we would also like to express some gratitude for our communications team who helped make this event possible. And now it is my pleasure to introduce my colleague, Casey Sink. Casey is an analyst here at KHI, and she will be leading you through today's session.
Thanks, Rebecca. Hi, everybody. My name is Casey Sink. Thank you so much for joining us today. I'm really excited to be here with you guys to discuss health insurance coverage. We're going to explore some key trends, disparities, and a tool that can help us all better understand coverage and coverage gaps in the state. And something I'd like to start with before we get into the agenda and some of the material is what brings you here today. So if in the chat you could share one thing you're hoping to learn or take away from this session, it would really help us get to know your interest and what you're interested in learning today. So before we dive into the data, let's take a look at today's agenda. We'll start by reviewing the current landscape of health insurance coverage in Kansas, including where people get their coverage, how these trends have changed over time. Next, we'll look into characteristics of the uninsured population in Kansas, and then from there, we'll introduce a tool we've developed here at KHI that provides insights into insurance coverage at the county level. We'll break out into groups and you'll get a demo from a KHI expert, and you'll have time to explore and interact with that tool as well as ask questions. Finally, we'll wrap up with key takeaways and next steps around 12:55, and then we'll end around 1 p.m. So with that, let's get started. Okay. So let's start by looking at the overall landscape of insurance coverage in Kansas. Understanding the distribution of coverage types helps us see where gaps may exist and some of the trends that are emerging. In 2023, which is the most recent data year available that we have, Kansas obtained health insurance from several different sources. These include employer-based insurance options, Medicaid, Medicare, direct purchase, and other public programs. So you'll see on this pie chart, it visualizes the distribution of all of these options and where people are getting their insurance in Kansas. The biggest portion of this pie chart is private coverage. Those are the blue shades. The biggest slice of that is employment-based coverage, and that's about 54%. The other small portion is direct purchase, and that's about 6.5%, totaling about 61.2% of Kansans. The next biggest slice is public coverage, and that's making up about 30.6%. That includes things like Medicare, Medicaid and CHIP, both Medicaid and Medicare, and VA healthcare as well. The last slice is the yellow or gold color, and that is the uninsured in Kansas. Those are folks who do not have health insurance or were estimated to not have health insurance during 2023, and that is at 8.3%. On this infographic, we see a deeper dive into various insurance sources. Employer-sponsored insurance remains to be the most common source. We can see that in 2023, there was an estimated roughly 2.8 million Kansans, and about 1.7 or 1.8 of them were receiving private coverage. That includes the employment-based coverage and things like military TRICARE and direct purchase. But we can also see that the public coverage also makes up a significant role for particularly lower income populations and retirees. We can see that about half of them are made up of Medicare, about 460,000, and then 340,000 come from Medicaid and CHIP. Taking a deeper look into private coverage, we'll talk a little bit more about the direct purchase, particularly with the Kansas marketplace. In 2023, there was 188,000 Kansans who selected direct purchase, and 65% of those chose plans through the Kansas marketplace. So this trend helps us see how it's changed over 10 years. Starting in 2014 with the launch of the marketplace, we saw an initial start of about 57,000 enrollees. This quickly doubled in the year after at 2015 with about 96,000. This remained pretty steady for about 5 years until the pandemic. Right after the pandemic, we saw the introduction of the American Rescue Plan Act, or ARPA, with enhanced subsidies beginning. And right after that introduction, we really see these numbers start to take off. Starting in 2021, just after the pandemic, we have about 88,000 enrollees in this choosing the Kansas marketplace. And right after, we see it skyrocket to almost double at this past year being 171,000. Another key factor in insurance coverage is how different populations are accessing health plans. Marketplace plans, Medicaid expansion discussions, and employer-based coverage changes all shape these trends. And so we talked a little bit about the private coverage on the left side of the screen and public coverage on the right. And now we're really going to hone in and focus on the total uninsured. So all this infographic, which you're welcome to pull up on your own, there is a link in the chat so you can see those numbers a little bit more clear. We do break down the uninsured by age groups. The biggest portion of the 240,000 uninsured Kansans are adults aged 19 to 64, making up 196,000. So over half of those uninsured Kansans are adults. The next largest group is children. Those are age 0 to 18, and they're about 40,000 in 2023. And then the last age group that we narrowed down to was seniors, and those are adults aged 65 and older. You'll also see on this infographic that we break down these age groups by eligibility categories. So that's what some of the coloring is on the bottom. It's a little bit easier to see pulled up on your own. You can take time to look into this after this session. The links will be provided. But you can see that the dark blue is who is currently eligible for Medicaid or CHIP during the data year. The light blue is who would qualify for Medicaid if it were to be expanded in Kansas. The gold color is who would qualify for subsidies on the marketplace and would be ACA eligible. And the light yellow is similar. It's who would qualify for subsidies on the marketplace, who would fall under the IRA eligibility. Here we compare Kansas uninsured rate to other states across the nation. This context helps us to understand where Kansas stands nationally. We can see that Kansas in the middle is at that 8.3% uninsured rate that we talked about. The US overall rate is 7.9, so just a bit lower. The blue colors represent percent rate ranges. So the US, Kansas falls into the second highest blue color between 6.8 and 9%. We can take a look at our neighbors, for example. So Missouri is a little bit lower with 7.4%. Nebraska, Colorado are also lower. Oklahoma falls into that darker category at 11.3%, and Arkansas as well. Kansas uninsured rate was ranked 19th highest in the nation in 2023. And this was an improvement from 2022, where we were ranked 13th. So we moved down just slightly, but overall, we have shifted about 11 positions since 2009, when Kansas had a lower uninsured rate than the United States. So looking at the trend from 2009, in 2009, we had an uninsured rate in Kansas at 12.6%. And overall, this rate has decreased over the more than 10-year period. We saw a bigger decrease from 2009 to 2015. Since then, it's been a little bit more stagnant, but overall, we have been decreasing in Kansas. We can see that things became a little bit more level after 2014 with the implementation of major ACA insurance expansions. Then when we compare Kansas to the US, we can see how those rankings have shifted over the past more than 10 years. So looking back at the 2009 to 2014 range, we can see that Kansas was well below the US uninsured rate. And then around 2015, right after that implementation of ACA insurance expansions, it started to even out a bit. The Kansas overall and US overall were neck and neck, right on each other. And then the pandemic happened in 2020, and that's why you'll see no data there. There was no data available. In 2021, when we were able to start making this comparison again, we can see that the US rate is now lower than Kansas, and it has been for the past couple of years. Okay, so now we're going to take we've looked at the trend, we've looked at what the picture has looked like for more than 10 years, and now we want to focus on the characteristic of who are the remaining uninsured Kansans, and understanding who remains uninsured really helps address the existing barriers and potential opportunities and gaps that exist for their access. So some overall information about some characteristics. Nearly 40% of the uninsured are aged 26 to 44. A large portion have incomes above the poverty line. And this suggests, that affordability, job type, eligibility restrictions may be barriers in coverage. Disparities in coverage are evident even when we look at race and ethnicity. About 3 in 10 of Kansans that were uninsured identified as Hispanic any race. When we look at the trends of these race and ethnicity groups, we can really start to see that gap emerge, and we can see that that gap has existed for a long period of time. So the green line is the line we were looking at together a few slides ago. It's that overall Kansas uninsured rate. The green line. The yellow line represents Kansans who identify as white, not Hispanic. And we can see that since 2009, that uninsured rate has typically been well below the state overall average rate. The white or gray line represents Kansans who identify as Hispanic, any race. And we can see going back that this disparity between the overall between Kansans who identify as white, non-Hispanic, has been large and is still persisting. It has gotten a little bit better. The uninsured rate for Hispanic, any race Kansans has decreased about 13%, which is a great win. But that disparity between the overall Kansans and Kansans who identify as white non-Hispanic is still very visible in this graph. Get a little bit more context about other groups in Kansas. This graph is a little bit harder to see. That's why we separated it out for you guys. But the dark line that's now appeared is Kansans who identify as Black non-Hispanic. And the light gray blue line is Kansans who identify as other or multiple races. The other multiple races category includes Kansans who identify as Asian, Alaskan Native, American Indian, all of those groups that are just a little bit smaller in Kansas. For data purposes, to get a reliable estimate, we have to group them together to be able to reliably compare against groups. So that's why they're grouped together in that one. But for both of those groups, we see a slightly similar pattern. The highest point being around 2009, there was an increase amongst other multiple races in 2011 slightly, but generally higher rates from 2009 to 2015. We see that decrease even going into 2023. And then looking at the most recent year in 2023, we see that Black non-Hispanic Kansans are still higher than the overall uninsured rate. Other or multiple race Kansans are right around the same mark as all Kansans overall. So this trend chart, it's really important to look at those rates individually, but looking at them on a trend line really helps us see, there are still barriers that aren't being addressed somehow, and this data helps understand how we can address that. Okay, so we're now going to look at the geographic distribution of the uninsured population, and we're going to look at this by urban and rural differences. This first map just breaks down what rural or urban category counties fall into. So if you can, take a moment, find where the county you live in is, the county you work in, the counties you serve. The darkest color on the map represents frontier counties, and that is the most rural category. It means that there is less than 6 persons per square mile. The next category, the second darkest green, are rural counties, and that's between 6 and 19 persons per square mile. The next rural category, the lightest green, is densely settled rural counties. That's between about 20 to 40 persons per square mile. And then moving into the urban categories, we have the darkest blue, which is semi-urban counties, which is between about 40 to 149 persons per county. And then the most urban category is urban, and that's 150 or more persons per square mile. So before we look into the uninsured rate by these categories, take a moment and, look which category your counties fall into. What do your neighbors look like? We can see kind of a pattern. I think most of us that are familiar with Kansas, you can see in the West that there's a lot of frontier counties. There's a few in South Central Kansas. And then as we move east, There's a few more semi-urban counties. And then once we get into the Kansas City and Wichita areas, you see those urban counties start to appear. So now that we know which category our counties fall into, we can look at what the uninsured rate looks like. So for all this is across all frontier counties or all counties within the rural and urban classification. Across all frontier counties, 12.4% of the residents are uninsured, and this equals about 9 or 10,000 people. In rural counties, this percentage is a little bit lower at 11.4, but it equates about 20,000 people, so a little bit higher. Densely settled rural counties has a little bit higher of a percentage, but very similar to rural at 11.9%. And then for semi-urban and urban, they have the same uninsured rate at 9.6%. At the bottom there, you can see the overall Kansas uninsured rate. And I should mention that this data is a little bit different than the trend data that we were all looking at together. This is a different data source, and the most recent year for this is 2022. So the data lag is a little bit bigger. And then it's also only provided for the ages of 0 to 64. In comparison, we are looking at all ages earlier. So that's why the overall number might be a little bit different than what we were looking at together earlier. But this data is still really helpful to understand the context of your community and some of those uninsured experiences. So looking again at those rates, but on a bar chart, we can really start to see how different or similar the rates are. We can see that those green bars that represent the rural categories are higher, and the overall rural uninsured rate is 11.8%, which is higher than the overall Kansas 0 to 64, which is 10.2. And then the blue bars, the total overall rate is 9.6%, which is lower than that overall Kansas 0 to 64 rate. So like we have with the other data, we're going to take a look at how this rate has changed over time. So you'll see the colors are still the same on each line. Frontier is the darkest green, urban is the lightest blue. So they'll still be the same color that your county was. And we can see that for most of them, there's been a decrease, similar pattern that we've seen with a lot of uninsured rates for different characteristics. There's been a decrease over time. It's been pretty similar in the last 3 years, from 2022 going back to 2019. But we can really see that the frontier, the darkest line, has persisted as the highest uninsured rate going back to 2009. So even as it has decreased, it still remains the highest rural urban classification group with the highest uninsured rate. So to help visualize this data, we at KHI have developed an interactive dashboard tool that allows users to explore insurance coverage trends at the county level. So you're going to be able to look at some of the data that we looked at together at your county level and compare it to other counties. This tool is a really valuable resource for policymakers, healthcare professionals, or community advocates. And then you're going to be put into rooms right after this, but this is what the dashboard will look like when you're in the room. You will have a KHI expert walking you through all of the data, answering any questions that you have, and comparing counties for you. We're hoping that this gives you a really great hands-on experience with the data. and you'll be able to look at all of those uninsured characteristics, even some other characteristics that we didn't cover here together. So that'll be really valuable. Some of the objectives of the breakout rooms. The first one is just to get you to be introduced to the dashboard or tool, learn how to use it, how to explore it, look at the counties where you live or work or serve, and look at what some of that data looks like. And then lastly, we want you to think about how this data can be used in your community or work. So this QR code, and we like to call these the scavenger hunt questions for the dashboard, will be dropped in the chat when you go to your rooms. But they're just giving you a few prompts of things to look for as either your facilitator is working through the dashboard, or if you want to save it and look through these questions another time, you're welcome to keep it and kind of explore it yourself. But we want you to ultimately learn how to find and click on your county, look at the uninsured rate and how it compares to your neighbors, looking at the difference between private and public coverage in your county and how it compares to Kansas or the US. And then another option on the dashboard is looking at deeper into those characteristics. You'll get to look at race and ethnicity and age, which we looked at together, and family income, but there's a few other ones that you'll get to explore that may be meaningful to your work. And again, on that tab, we really just want you to be able to become familiar, understand those characteristics, and then learn how your neighbors are similar or different. And we will be split up into even rooms. You will each have a KHI facilitator, and they will be walking you through the dashboard, and then we'll come back, do some of those key takeaways, and reflect on what we've learned. So before we wrap up the day, I just want to reflect with everyone, if you could share maybe one insight from the dashboard that really stood out to you, or how you might think about using this tool in your work or in your community. I know for our group, we had some comments. People were surprised at the differences between some of their neighbors in their own county. Um, I wonder if facilitators, maybe you want to mention some of the conversations you had in your group.
I'll share if that's okay. Maybe it was maybe it was the next question or something in between. One of the suggestions from the group was to be able to show change over time. So if, as we're thinking about this dashboard in the future, keeping this current map, but adding subsequent years so we could see how a county's experience changed over time, and perhaps how their neighbors' experience changed over time as well.
Okay. Looks like we got some comments.
One that we pointed out was looking at specific populations or looking forward to investigating why certain populations aren't insured, like children, and how certain policies impact that.
Yeah, I think that was certainly a question that came in our group. When as you're looking at these different things, the question always sticks out: why? Why is this one higher? Why is this one lower? And so, trying to think about the fact that what is the industry in the county, employers, and that availability of employer coverage. Obviously, income levels will impact that as well, and so there are a lot of different factors that would play into how many people might have coverage. I appreciate the comment somebody put in about this certainly could be a good tool to use if you are working with trying to get people to get coverage, and so you can kind of see where there are folks that maybe could use some extra help.
I'm really glad to hear it was useful, or at the very least interesting for some folks to explore. We hope it can be really helpful in the work that you're doing, and communicating about this issue to stakeholders or others in your community. If we weren't able to answer all of your questions today, or if you run into anything else, please feel free to shoot us an email. We're always happy to answer questions or get feedback from you guys on the dashboard. Thanks so much for participating.
Thank you, Casey. And again, thank you everybody for your time today and for your engagement in the breakout rooms. I think it's so helpful to be able to connect with you and hear from you. You know, how are these tools and how is this information helpful for your role and context? And so to continue supporting that effort, we would also like to ensure that you have access to all the materials and resources that were mentioned today. So if you hop into the chat, you'll see a PDF of a resource guide that includes links to the different reports, the dashboard, and the infographic that you can access, you know, after today's session. There's also a couple of discussion questions there for you to continue reflecting about this information and what it might mean for your role or community, or you can even take those questions to your team and your organizations as well. And so again, we want to make sure that you have access to that information. And we also want to be able to continue designing events like today's, you know, that are meaningful for you and helpful. And so we would love if you could click on the link in the chat or scan this QR code for a feedback survey. And your feedback is really important in how we think about designing these events and what topics and what formats we use. And also in the feedback survey, there is an open-ended question at the end for additional comments or questions. So if you do have specific feedback about the dashboard, I heard it in our breakout room, please be sure to add it there so that we can track that information and then continue to make improvements. And so I'll leave this QR code up for a moment. If you need to scan it, the link is also in the chat. You can grab that resource guide in the chat as well. Thank you so much for being here today. We really enjoyed getting to hang out with you over lunch for today's first Bring It session, and we hope to see you on Thursday for Medicaid, what to expect in 2025.